Hi everyone, this is Dr. Kaur with Greater Washington Advanced Podiatry, and I'm here today to discuss Hallux Rigidus or big toe arthritis. So what is big toe arthritis? Essentially, this is what it looks like, and what happens is bone spurs can start to occur at our big toe joint, secondary to our first metatarsal. Here is a diagram of the foot, and what happens is if this first metatarsal or long bone is either too long or it's sitting in a more elevated position than needed, there can be some jamming at this joint that can start to occur, and this jamming can eventually, cause us pain and limitation in our motion. And there's different stages to this arthritis, so first we just have some slight cartilage loss, but then it can start to advance into a more tight joint or, pain as patients, put weight on their foot or do, activities that, require some intensity. And then the final stage is kind of, pain at all times of the day. The causes of this arthritis are generally, genetic. You have either a long metatarsal secondary to some kind of genetic component, but it can also be, predisposed in patients that have flatter feet, or also patients that, tend to wear a lot of high heels throughout their life and, put a lot of weights on their forefoot. As well as, patients that are older in nature. So in terms of conservative treatments, the way that, we try to treat this is through supportive shoe gear. So shoes that are, more rigid in nature and more supportive, such as a New Balance or a Brooks. Also, sometimes we can make an orthotic with a custom modification for this specific condition for Hallux rigidus called a Morton's extension. We can also do cortisone injections, anti-inflammatories, even physical therapy sometimes. If those things happen to fail us, there's always, surgical intervention options that we have for us. So one of the most common being just a clean out of the big toe joint, where we go in and remove any arthritic, spurs or osteophytes, as we call them. The level 2 of that would kind of be putting an implant in. Now they have, FDA approved implants that are extremely minimally invasive, and you can, start to bear weight on your feet immediately after surgery. And then the last kind of option would be a joint fusion. So, there really are a lot of, tools in our arsenal that we have. So you really shouldn't be suffering with pain. And if you believe you are, then please go see your local podiatrist and, get the help you need. So thank you so much for watching. Have a good one.